Hello everyone, and welcome back to our channel. Today, we're diving into a crucial topic for anyone studying nursing or medicine: post-operative hypoxemia. We'll break down a practice question to understand the most direct sign of this condition. Imagine this scenario. You're caring for Mr. Reyes, a 55-year-old patient who just came out of surgery. He's still a bit groggy from the anesthesia. You're monitoring his vital signs, and you notice a change. What would be the most direct indicator that he's experiencing post-operative hypoxemia? Would it be A. Excess carbon dioxide in the blood, B. Increasing ammonia in the blood, C. A reduction of blood pH, or D. Decreased oxygen saturation? If you chose D, decreased oxygen saturation, you are absolutely correct. Let's explore why. Hypoxemia, by definition, means there's not enough oxygen in the arterial blood. The quickest, most non-invasive way we measure this at the bedside is with a pulse oximeter, which gives us the SpO2 reading. Right after surgery, several things can cause this drop. The lingering effects of anesthesia can slow down breathing. The airway might be partially blocked, or there could be a mismatch between airflow and blood flow in the lungs, what we call a VQ mismatch. A falling SpO2 is our immediate red flag that tells us the patient's body aren't getting the oxygen it needs. So, why are the other options incorrect? Let's look at excess carbon dioxide, or hypercapnia. While this can happen after surgery due to slow breathing, it's about CO2 retention, not a direct measure of oxygen levels. A patient can have high CO2 and still have adequate oxygen, or vice versa, so it's not the primary indicator. What about increasing ammonia? Elevated ammonia levels are linked to liver problems, like hepatic encephalopathy. This isn't something we typically check for when assessing immediate respiratory status after an operation. It simply doesn't reflect the patient's oxygenation. Finally, let's consider a reduction in blood pH, or acidemia. This can be a consequence of severe, prolonged hypoxemia, when the body's tissues aren't getting enough oxygen and start producing lactic acid. It can also result from high CO2 levels. However, this is a later, more secondary finding. The drop in oxygen saturation is the earliest and most direct sign we will see. So, the key takeaway is this: in the immediate post-operative phase, the most direct and earliest indicator of hypoxemia is a drop in the patient's oxygen saturation. Here's a simple mnemonic to help you remember what to do. SATLO. Hypoxemia, when the oxygen saturation drops. Check the yake airway first, and then read the cause. This simple phrase guides your immediate actions. Ensure the airway is clear. Optimize breathing and provide supplemental oxygen as needed. Thank you so much for joining me today to break down this important concept. I hope this explanation was clear and helpful for your studies. If you found this useful, please give this video a thumbs up, subscribe to our channel, and hit that notification bell so you don't miss our next one. Keep studying and stay curious.